Hello, and thank you for joining us today for our free webinar, Tips and Tricks for Telemedicine Insurance Billing in California, featuring Sarit Hirschkorn. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. With the current state of the acupuncture profession, the nation, and the world, we have decided to add to our webinar offerings to bring in experts in telemedicine, practice management, and insurance billing, in addition to our traditional clinical skills-based webinars. Our guest speaker today has graciously agreed to offer sessions each day for specific states so we can focus the content and share the most relevant for you. I will just go through a few housekeeping items now. We recommend viewing the webinar in Chrome, Firefox, and Safari, as you may experience slowness in other browsers. If you're having any issues with sound, try clicking on the screen to allow the sound. And if you experience any freezing or delay, try refreshing the page, and if that does not work, we would suggest trying to watch it in another browser. Everyone who registered for this event will receive a link 5 minutes after we conclude to watch the webinar on demand in case you miss anything. And lastly, we will be holding questions till the end. If you have a question for our guest speaker, please use the questions tab to assure that we ask it at the end. And if you want to communicate with other attendees or to communicate any technical difficulties, please use the chat tab. Now for our featured speaker, we are proud to introduce Sarit Hirschkorn. She is co-founder and co-owner of AllAcuServices, LLC, a company specializing in insurance billing services for acupuncturists, massage therapists, naturopathic doctors, chiropractors, physical therapists, and social workers. After spending nearly 2 decades working in corporate benefits outsourcing for multi-million-dollar companies such as PricewaterhouseCoopers, ACS, and Mellon Bank, Sarit now applies her deep knowledge and understanding of the insurance industry to the field of insurance billing for holistic healthcare providers. Please join me in welcoming Sarit.
Thank you, Jeffrey. Good morning, everyone. Good afternoon. I'm Sarit. I am the owner of AllAcuServices. We specialize in billing for acupuncturists, as Jeffrey said. My partner, Robert Vena, is a licensed acupuncturist in the state of New York and in the state of Jersey. I want to take you through today. I want to make sure that we talk through some of the terminology of what is telemedicine and what is telehealth. I want to make sure that we have a clear understanding of what that is. I want to talk about what it is that we can bill as an acupuncturist and how often can we bill, and then definitely go through the different codes that you can use for telemedicine. Do you need modifier? You don't need modifier. Then give you a formula that will help you figure out the prices based on your current prices that you're charging for acupuncture. And then we'll talk in the end about HIPAA rules. And as Jeffrey said, when we're done with the presentation, we'll leave 30 minutes for questions. Any questions that are not answered, we'll take them afterwards. We'll write them down, and then we'll get back to you with the answers once we are done with the research. So we'll start with terminology first, and we'll talk about telehealth. So telehealth is the use of electronic information and communication by a provider to reach out to their patients. Can be done by you either doing an assessment of the diagnosis, a consultation, a treatment, education, care management for your patient, and even self-management of the patient themselves. It has to be patient initiated, and many of us ask, well, as an acupuncturist, how do I really have my patient initiate those patients, or how do I even provide telemedicine? Telemedicine is another avenue that falls under telehealth, okay? And that is really the use of live video streams, phone calls, faxes, emails. Those all fall under telemedicine. We can reach out to the patient by checking on our patients. This is a very, very stressful time for many of us, and many of us being at home. You know, we have some good days, we have some bad days, and for us to reach out to your patient, it would be something that it would be greatly appreciated by your patient. And you can let them know that you are available if you want to have a discussion with you. If they do want to talk about either existing diagnosis, either acute or chronic pain that they previously had, or something else that may be bothering them now. Telemedicine is considered to be similar to an evaluation. It is an evaluation, okay? And the law says that it has to be an existing patient with either acute pain or chronic pain, but you'll see that many of the insurance companies have stretched that out, and they are allowing even new patients to be reached out to using telemedicine. If you did reach out to your patient specifically via a phone call, and that led for your patient to be seen within the next 24 hours, you cannot charge for the telemedicine codes, but you do have to charge for the acupuncture treatment. I'm going to go a little bit through what California allowed in terms of state laws, and then we'll talk about the different insurance companies and what they're offering or what they're actually not offering as of right now. Okay, so let's talk about the state laws. We talked about what telemedicine is, and if you look at the law, it basically tells you, right, that it has to be an assessment, an education, self-management, pressure, consultation. They all fall under telemedicine. The law may be changing. There was something that was passed in the legislation as of January 1st, 21, where they don't want to restrict the companies that are allowing the video streaming. So there'll be many companies that will allow it. Also, what we're seeing, the Medi-Cal, which is the Medicaid in California, does offer telemedicine. And because Medi-Cal does offer it, we are seeing that some insurance companies that are privately owned will offer it as well, okay? They can exclude telemedicine if the plan itself does not allow acupuncture. So if the plan does not allow acupuncture or the patient does not have acupuncture benefits, they are allowed to exclude telemedicine services, okay? We're going to go on to the next slide, and we'll see what it is that we can actually offer under telemedicine, what it is that I can do with my patient, being that we're so used to being hands-on, having the patient in the room, being able to needle the patient. But now the patient is no longer in the room. What is it that I can offer? Well, as an acupuncturist, you are qualified to do a lot more than just needle a person. We can do things such as Qigong and breathing exercises, meditation. Those all fall under telemedicine. These are things that you can do sitting with the patient on the other side of a live video stream, okay? Discussion with your patient about their current diagnosis, or previous diagnosis that bothers them, how they should maybe self-help themselves by showing them acupressure points. And we had many of our clients that actually took a chart, an ear chart, and pointed out different ear seed points that the patients can do. And they sent their patient ear seeds. And once the patient received the packet of the ear seeds with the little ear chart, they spend the time on the phone with their patients on a video stream, putting in those ear seeds. And for them, it's A, another revenue stream for selling out those ear seeds, and B, they get to spend the time with the patient on the phone and really showing them how to put and manipulate those ear seeds. Things such as herbal consultations is something that you can do as well. So if you're selling herbs to your patient, we suggest that you spend the time with your patient on how to take those herbs, maybe how to cook those herbs. It's something that you can do as well. Preparation for the meeting with your patient. It's something that will count towards the time of your telemedicine. We'll talk about time and how to measure the time in the next slide, but this also the preparation of the notes after and the preparation of the notes of reviewing prior to your meeting with the patient to remind yourself what the patient was suffering from, so you will be able to talk to the patient smartly about the diagnosis, okay? Any decision-making that you make on the phone or on a video stream also count towards the time. And other things that you can do is also a tongue diagnosis, right? So in the live video stream, you are able to see their tongue and do a tongue diagnosis. You can talk to them even about nutrition, things to boost their immune system. It's something else that can be discussed with them on a video stream. Okay, so let's talk about the different codes that we have. We are looking at two sets of codes. We have a code that separates the video versus the phone. So we're looking at three different categories. We have a category of 5 to 10 minutes, a category of 11 to 20, and then I will say 21 plus. You're not really cut off at 30 minutes, but they won't pay for anything other than this last category of 21 plus, okay? Because we are not distributing the PowerPoint presentation, I suggest that if you want to take a screenshot, feel free throughout the presentation to take screenshots of this. And I want to go through these codes again. So code 99421 is the code that you're going to be charging for 5 to 10 minutes you spend with your patient on the live stream video. And because we can for this code only once every 7 days. So today, let's say today I talk to Jeffrey on a video stream when we have a small discussion. And today is Monday. And then I decide to check in on Jeffrey again on Wednesday. And I talk to Jeffrey for another 7 minutes today. I add the 5 minutes that I spoke to Jeffrey today and the 7 minutes that I spoke to Jeffrey on Wednesday. That's 12 minutes. And I'm going to fall into the second category. So I'm going to charge for code 99422. Okay, it has to be cumulative throughout the week. Similar to that, if you talk to your patient on the phone, again, the minutes are cumulative for 7 days. The minimum that you can speak to your patient is for 5 minutes. Okay, and that again includes your notes taking, your documentation, your preparation prior to the meeting, and then after the meeting. Each one of these codes need a modifier of 95. And the place of service, usually going to put on a HIPAA form where you usually put a place of service 11, which stands for office visit. You're going to put 02, which stands for telemedicine. Okay. So 99423, right, is very similar to evaluation code that you do today as 99213. Okay. Similar to that, 99443 is a phone conversation that is similar to your evaluation code. Now, I want to talk a little bit about pricing. And I put in the pricing for acupuncture set 97810, and I put in the relative value. And for those of you who don't know what relative value is, relative value is what does this code worth to the insurance companies. So you can compare 97810 to 99421 to 99422 to 99423. So if we charge $100 for one set of needling, and I want to make sure that the numbers are super easy, selected easy rounded numbers. If we charge $100 for 97810, right, we can see that for 99421, it's about 40% of that same code, right? It's 0.3. So I would charge about $40 for 99421. I would charge about $80, right? Because it's 0.83 for 99422. And I would charge about $120 for 99423 because that code is actually worth more than the one set of needling. Okay. We are seeing that insurance companies are starting to pay. So companies such as Aetna, Cigna are starting to pay. And we are seeing that they're paying for code 99423 about $70. That's what we're seeing on the claims that are currently processing. They're valuing it as about $70. It is also very important that you document these sessions and you give your patient the same standard of care as if the patient was in the office. So that this does have to be documented as if you provided an evaluation or consultation to your patient. And you can use, again, if you're using today hard copy, continue using hard copy. If you're using electronic copy, use electronic copy and make sure that you document the session. Okay, moving on, because what I did is I put a couple of insurance companies of what we are seeing today, and what you need to keep in mind that this changes daily. If you log into the different websites for the different insurance companies, you'll see that every day they publish what it is that you're allowed to perform and what it is that you're not allowed to perform, whether certain providers are allowed to perform telemedicine or not. And I'm going to start with Aetna. So Aetna went out of their way, and they are allowing both in and out of network providers to provide telemedicine. Not only they're allowing certain providers to perform these services, but they're waiving co-insurance. They're waiving the co-pays, and they're waiving the deductibles, both in and out, both either a phone call or a live video stream. Companies like Ash, Companies like Ash manages or administers many of the plans, right? Specifically for Blue Cross Blue Shield or Anthem, right? And because Ash did not get directions as of yet from the specific companies that they're managing, they're right now not allowing it. So if you have a Blue Cross Blue Shield plan that is managed by Ash, this plan most likely will not allow the provider to perform telemedicine until Ash gets a guideline from that specific provider. So we're seeing that both Blue Shield of California and Anthem Blue Cross right now are not allowing telemedicine, not for in-network providers and not for out-of-network providers. They're not allowing it via live video streams, and they're not allowing the phone calls. Where companies such as Cigna and Aetna are allowing these types of services. Also want to focus specifically on Cigna, because Cigna went out of their way, and they did indicate that instead of using our usual telemedicine code, instead of using these specific codes for telemedicine, they did instruct providers to use the 99213. So our regular E&M codes, our regular evaluation codes, so 99213, 99212. They did instruct us to use these codes. However, they did put a note to use that with a modifier of GQ. Okay, so if you are submitting claims to Cigna, please use the regular evaluation codes with a modifier of GQ and an office location 11, not 02. Cigna did publish on their website that right now they're not able to manage the number of claims. Their systems are not capable in managing the number of claims that are coming in with a location code of 02 or with the new telemedicine codes, and therefore providers should use their regular E&M codes. With that said, our company did submit telemedicine codes for Cigna, and we are seeing them getting paid and processed. But Cigna did put a disclaimer that codes may be denied if you're submitting with telemedicine. Don't be alarmed. Just submit with an evaluation code. Also, what we are suggesting for you to do is, if you have patients that are interested in telemedicine, that you do verify their coverage with the insurance company. Why should you verify their coverage? Because we're giving you here very high-level guidelines on these specific insurance companies. However, every plan is different, and there are some plans that may cover it, or there's some plans that will not cover it, even though they fall under the Aetna or the Cigna umbrellas. Why? Because self-insured plans don't have to adopt the state laws, and they don't have to cover the patients for telemedicine. Also keep in mind that if a patient is not covered for acupuncture, for the most part, they probably will not be covered for medicine, because that provider is not allowed to provide services under that specific plan. So if you call the insurance company, we suggest that you ask the name of the rep that you spoke, that you take a call reference number. It's a good idea to also ask them what modifier their system will allow. Some insurance companies use a modifier of 95, some use GT, and we are seeing with Cigna is using the regular E&M codes or the evaluation codes with GQ. So it's a good idea to ask them. Also ask them if you need a pre-authorization for that code, because if the acupuncture needs a pre-authorization or an evaluation and is not allowed, ask them if the code is allowed if you do get a pre-authorization. What I also did in here is we are suggesting for people to use HIPAA compliant systems. It's a good idea so the patient's information is not getting compromised, although we are seeing that they're being a little more laxed with HIPAA rules and they are not really enforcing the HIPAA penalties. However, if I would be a patient and I went to see a provider, I would really hope to use the HIPAA compliant system so my data is not compromised. I'm going to talk a little again about, and I see, Jeffrey, that you answered that question with regard to Cigna. Cigna does use a modifier of GQ. Thank you, Jeffrey. So if there are any questions, I guess we can start with the questions. If we need to review again on how to add the time, how to add the codes, we can do that as well.
All right, you said you were ready for questions?
I am ready.
All righty. So I do see a couple of questions that are going into the chats right now. So I'm going to just quickly go through those, and then we're going to move into the questions tab. Once I move into the questions tab, I'm not going to be looking at the chat anymore. So I would just people start putting them in the questions area. Somebody wanted to know, would it help for us to contact Ash and ask them to pay us for telemedicine?
I mean, you can always contact Ash. Ash told us, and we called on several, we called from several states. So we called from California. We have several clients in California. We called from Colorado, and we called from Oregon. Ash is mainly used on the West Coast, not so much on the East Coast. And we are told that we're waiting for guidelines from the insurance companies. And it's not just in the state of California. It's also in Oregon, and it's also in Colorado. So once they get instructions, it would actually be a better idea if your patient contacted Ash or their specific insurance company and started pressuring those insurance companies and not the provider. So I would have my patients do it.
Okay, perfect. The patients make sense. And then will these codes count as an acupuncture visit to deplete the patient's allowed amount?
So we are not seeing that it counts against the acupuncture visits. The reason that we don't see it counting against the acupuncture visits because they're considered the same as evaluation codes. So some plan may specify that a patient may have only one evaluation per year. So I would ask them if there is a restriction against the evaluation or the office visit codes as they referred by the insurance company, but not towards the acupuncture codes.
Okay, and then he asked if the modifier GQ is also going to be with Aetna as well.
So we submitted with 95 with Aetna. So when we submitted our claims with Aetna, we submitted it with the modifier of 95 and are getting paid with 95. If you're having a hard time, just resubmit your claims with a GQ. But so far, we're seeing all of our claims on Aetna paying the modifier of 95. And of course, the office visit has to be a 02. So I'm going to go back to it, right? So the place of location has to be a 02.
Okay, and actually, let's go back to the very beginning. There was somebody earlier in the chat who wanted to take some screenshots of the first couple slides that we went through. Mm-hmm. So let's go back there. We'll go back to, I think, slide 2. All right, so if Geraldine, if you'd like to take a couple screenshots, please let me know when you've done that. Let's see. And then somebody asked about billing Cigna as normal location 11.
Yeah, that's correct.
Okay.
Although, Jeffrey, it's not really consistent. I mean, that's what Cigna published on their site. This is directly from the Cigna site, and I don't know if we can make this any bigger, but this is from the Cigna site. They did say to use the regular E&M codes with location of 11. However, we submitted it with place of service as 02 and the regular telemedicine codes with a modifier 95, and we're getting paid. So, you know, it really depends on how their system is going to react, but they are allowing it. So if the telemedicine doesn't work, submit the evaluation codes, which I think are safer from my perspective.
Okay, and then somebody asked what kind of diagnosis codes?
So the diagnosis codes really depend on the patient's plan. We all know that Cigna and Aetna have a diagnosis restriction. Aetna is more restrictive than Cigna. However, call and ask, is there a diagnosis restriction? They may allow you to treat for stress even though on a regular basis, Cigna doesn't allow you to treat for stress and Aetna doesn't allow you to treat for stress, it's probably best to focus on pain. Even if your patient is suffering from stress, you need to ask them, does it affect you in anywhere? Do you get headaches, shoulder pains, right? Neck pains, and try to focus on the pain diagnoses more than diagnoses such as stress or fatigue, etc.
Okay, and then somebody did ask you if you can repeat the recommended fees for the different lengths of time, please.
So it's not a recommended fee, right? It's the formula, right? I can't recommend fees, right? What I can recommend is how to figure out what it is that you are charging to charge based on what you're charging today. So look at what you're charging for one set of needling, right? If you're charging for one set of needling, $50, right? These first set of codes, and I'm looking at both like the phone and the digital evaluation, which is the video. You see they're worth about 40% of your first set of code, where the second set of codes, and I'll say the 99422 and the 99442 are worth about 80%. And you can see that the last code is worth a little more than your one set of needling. So it's kind of it's kind of a formula to figure out what the pricing you should use for your telemedicine codes.
All righty, and then does it work with workman's comp?
So workers' comp really depends on the insurance and the patient's plan. It would be a good idea to speak to the adjuster and find out if they will allow it. We saw that some plans will pay for it and some plans will not. The same thing with personal injury. Some plans adjusters allow it, like the insurance will allow it, and some will not. So it really depends on the insurance company.
Okay, and then this is more of a comment, and then I'm moving into the questions tab. But somebody said they called looks like BS of CA, which I'm guessing is Blue Cross Blue Shield. And where did it go? And they said that it was covered. So I don't know if that's maybe a new.
So again, it could be that some plans do cover. In general, we were told it's not covered. Some federal plans may cover it because it's on a federal level as opposed to a state level. We suggest that, right, as I said, this is very high level guidelines. We can't call every single one of the plans that Blue Cross Blue Shield has, right? And so we got very general guidelines from them. However, every patient's plan is different. We suggest that you call these plans and you ask them if your specific plan with dead ID, dead date of birth is actually covered and has telemedicine services.
All right. Let's start through all of these questions. So we have a bunch of them.
Okay.
Let's see. I work as a contractor in an FQHC. Other providers are doing telemedicine. Love to see things sprinkled in to explain if that makes any difference.
Not sure that I'm clear with the question.
So it's a community-based organization that provides comprehensive care and preventative care. So I think it's maybe understanding if there's a practice that has multiple disciplines. Are they going to be able to still bill insurance for their services?
So community acupuncture, when we bill for insurance, there needs to be a one-on-one connection with the patient, not community acupuncture. The insurance assumes that you're having that one-on-one and you're spending the time with the patient and not with several patients. You're not charging for several patients. So want to make sure that you are just having a one-on-one consultation with the patients. And if you do, yeah, for sure, you can bill for telemedicine as long, right, that the patient has coverage. And I'm only talking about insurance. I'm not talking billing the patient directly and getting cash checks, credit card from the patient. I'm talking with the insurance company. You need to make sure that you have coverage under that particular plan.
Okay, and then actually there was a follow-up question to that. So the other providers are doing telemedicine, like the PCPs. Are there limits, billing, and visits allowed within a 7-day period?
One, you can only bill for one. So it's one every 7 days. You got to add all the minutes together. And that's the category that you're going to fall into, right? So again, if I spoke to Jeffrey today for 10 minutes and on Thursday for 10 minutes, I am going to fall into the third category. Okay, you can only bill for it once every 7 days, not every day, not twice a week, not 3 times a week.
What if they saw the primary care and then saw the acupuncturist? Would those count together, or would those considered?
No, it does not, because different providers, right? Different rendering providers, different NPIs.
Okay, perfect.
So yeah.
Alrighty, and then how to telemedicine visit without being counted as an acupuncture visit?
It does not count towards your acupuncture visit. It is an evaluation, right? So when we look at what acupuncturists are allowed to do, right, there's several things that they're allowed to do, which is Twina, Moxa, heat lamp, evaluations. When we usually get the guidelines on how many visits they can have acupuncture, that does not count towards usually our evaluations. Those have their own rules, and it does not count against our Twina and Moxa that they have. They also have a different visit limit separately from the acupuncture. They don't fall into the same category because these codes fall under physical therapy. So with these codes, they fall under evaluation. They don't fall under the acupuncture umbrella.
Perfect. Somebody asked, will you cover super bill codes and how to bill if different from regular insurance billing?
So super bill should not be any different than what we bill directly to the insurance companies. If you're doing a super bill, just put in the code. Very similar, as if you were submitting directly to insurance company, it should look exactly the same, right? You put in the patient's name, you put in your clinic, NPI, and then you put in the code that you charge for, the diagnosis, the price, and you give it to your patient. It's instead of you, super bills are a replacement of, instead of you submitting directly to the insurance company, you're taking the same exact bill, giving it to your patient, and the patient submits it, except it does not have to be on a 1500 form.
Alrighty. Next question is, when do I use 99423 come to 99213?
99423 to 99213. 213. Well, it's different amount of minutes, right? So 423, anything over 21 minutes, and 213. I don't see a 213. Oh, what, the regular evaluation code? Mm-hmm. The regular evaluation code is used by Cigna. So that's the one company that allows evaluation codes. You need to ask when you call your insurance companies if they want you to use the telemedicine or they prefer that you use the evaluation codes. Even though you are providing telemedicine, you'll see that many of the insurance companies may not be equipped to even handle these telemedicine codes.
Alrighty, next question. I'm licensed in California, but live and practice in Oregon. Can I see and bill for patients who are in California?
You're licensed in California, and are you licensed in Oregon?
Let's say she's licensed in both.
Yes, then she can.
Okay. Alrighty. And then if she's not licensed in both, so if she's licensed in California but lives and practices in Oregon, would that change things?
Yes, we need to check the law, see if you're allowed to cross state lines and treat outside of your state. So it's something that needs to be looked into. Today, what we are seeing is that some states allow it and some states don't. Some states that allow it are allowing PCPs or MDs, but not specifically acupuncturists. So I would look into the state law and check if it's something that you are allowed to do for California.
Alrighty. But if she's licensed in both states, then there's no question and no problem.
Right.
Perfect. And then for Alicia, she would like to know, what about Blue Cross Blue Shield if it's not managed by ASH? Are they allowing it?
So we called Blue Cross Blue Shield that is not managed by ASH, and the answer was no. We called on several patients, and we were told no, and then we asked to speak to a supervisor to see if they changed their guidelines in general, and the supervisor told us that right now they're not allowing telemedicine. But then again, right, this changes daily. I mean, Cigna last week told us to use telemedicine codes, and then the day after they published and said to use evaluation code. I would keep calling and I would keep checking their websites to see if something changed. And, you know, if there's this patient who's interested, who does have Blue Cross Blue Shield, call and find out specifically for that plan. So.
Alrighty. Next question. Can we bill anything other than E and M codes 97110 if we guide a patient in therapeutic exercises?
Yeah.
And then, okay, so that's the only code they can bill?
Yes, it's either E&M codes or the telemedicine codes. Because you're not typically performing, right, the TWENA or the MAXA on the patient, right, or the cupping, right? You're guiding them, and guiding them considers to be an evaluation. It depends which code you're going to be using for the evaluation, right? These telemedicine codes are evaluations done via telemedicine. So it's comparable to the regular evaluation codes.
Okay, same person is asking, what if we give them press tax and guide patients through placing them? Can we still bill 97810?
97810. No, you're not actually putting in, like it's 97810 is the law says the insertion of needle, but you need to insert the needle as an acupuncturist, not patient themselves.
Okay, so. And then another question from same person. What if we guide them for using moxibustion? Can we bill 97039?
No, it still all falls, because you're not performing the services yourself. Somebody else is performing the services, and all you're doing is guiding them. It's considered an evaluation.
Perfect. And then what did you say about the place of service for Cigna?
Cigna place of service 11.
Okay, and that's the same as being office?
Yeah. The GQ symbolizes that it was telemedicine. So it's another modifier for telemedicine.
Okay, but not all companies using that same information, correct?
No,
okay.
No.
And then do you have any information on United Healthcare?
So across the country, when we called United, we're told that they're not covering it. So I would, though, encourage you to have your patients call as well and ask. But right now, we are told that United is not covering it.
Alrighty. And then America's Choice Provider Network?
America's Choice Provider Network. I'm not familiar with that network, so it's something we're going to...
Okay. ACPN is the acronym.
ACPN? It's something we're going to have to take a look at.
Perfect. And then somebody else following up about United Healthcare, what kind of diagnosis codes are payable for that one? But you're saying they're not covering currently?
I'm not seeing any plans to cover under United Healthcare, not for acupuncturists. They allow many other providers. Acupuncturist is not one of the providers that they're allowing. But that may change. We're seeing so many changes throughout the days until last week. In New York specifically, I'm going to talk for a second about New York, acupuncturists were not considered essential providers. We're now seeing that New York State started sending those acupuncturists emails and calling them and texting them to see that they are these providers, to see if they can come actually help with the COVID-19. And one of the options over there is telemedicine, anything that they can do to help. So insurance companies may change and may allow these acupuncturist, right, as an additional provider to provide services. So it's a good idea to check on a daily basis just their sites and what they're allowing and what they're not allowing, at least until June is what we're hearing.
Okay. And then I actually saw a fair amount of stuff in the chats earlier, and then now have a question. Will Veterans Administration pay for telehealth for acupuncture? And if so, which codes and modifier?
So we are seeing that TriWest is allowing, based on several of the plans that we called, and they told us to use the telemedicine codes. There was one person that we spoke to that told us to use the evaluation code, so it's just you call, but they are allowing it, and it does take from the visit limit that the patient has. So usually when you bill for the VAs, they give you, they do give you an authorization for a start and an end date, and the visit limit, it does take away from this visit limit.
Okay. Next question, can you please clarify between the 02 and 995 modifiers?
So 02 is a place of location of where you actually provided the services, and also the modifier, it has to be 95, which also indicates telemedicine. Both of them are an indication to the insurance company that it was provided via telemedicine versus in office regular visit.
Okay, and then next question, can we bill 99423 to 95 twice in 1 week if we do a digital assessment for 60 to 75 minutes?
99423. It has to be once every 7 days, right? If you go over your limit, right? So if you go over, if you did an hour even, you can only bill once. The insurance company care how long you did. This is 21 minutes or more, okay? So it's once every 7 days.
Okay. And then would they use the modifier of GQ or GT?
It depends on the insurance company. You should use 95. Should use 95, but unless you were told something else by the insurance company. But 95 is the modifier you should use. Only Cigna, you should use GQ.
Okay. And then for Medi-Cal, is telemedicine, Medi-Cal, is telemedicine rendered by an acupuncturist limited to chronic pain, or can it be used for anxiety, insomnia, etc.? I asked because before COVID, Medi-Cal covered acupuncture only for chronic pain.
And I would stick to the chronic pain.
Okay, and then next question, do patients need to meet their deductibles prior to getting paid for telemedicine codes?
It really depends on the plan, because we're seeing on many of the plans that they are waiving the deductibles and they are waiving the copays and the co-insurance. Also depends if the provider is in network or out of network. So I would call the insurance company to find out, but we are seeing that they're waiving it on many of the plans.
Okay, this seems a statement, but I've heard that for telemedicine, we need to use a code that has been used already for the established patient.
So on my first slide, I talked about who we can perform telemedicine for. I put that it has to be an existing patient. However, we're finding that companies are actually allowing not just existing patients, but new patients, because they want to alleviate the number of patients that are ending up in the ER or even in those urgent cares. So they are allowing new patients to be seen via telemedicine. So I'm going to go back to Cigna, because Cigna is so, Cigna publishes the details. And they did say that they're allowing, so did Aetna, allowing new and existing patients. We're seeing this also with the Independence Blue Cross Blue Shield. So slowly, they are actually opening it up to even new patients. So.
Okay, next question. Can you please confirm in regards to modifiers, digital versus phone, 02 versus 95 versus GPGT?
Okay. So I wish I can show you the Cigna site, because they actually show a whole, I don't know, Jeff, if you have that screenshot that I sent you with how to submit a claim. It was so nice laid out where on the HIPAA form.
Oh, let me see if I can find it. Just give me 2 seconds here.
Okay. It does lay out.
I'm actually pretty sure I can find it very easily here.
And if we can share that on the screen, it does show how to submit a claim.
Oh, got it right here. So now let me open that up. Now let's see if I can get this shared. Screen share. Application window. All right, let's try this. And how does that, is that what you're talking about?
Yes, awesome, thank you.
Okay, you're welcome.
Okay, so if you can see on this particular claim, right, this is in the HIPAA form, and if you look at it, what it does is it has the start date and the end date, and then you can see column B, it has the location, the place of location, it has 02. You put in the code, right, which is 99421, 99422, 99423, and then next to it, in column A, you put in the modifier of 95. And I hope that this is a little clearer when you are creating your claim, because this lays out the actual how to where to put the 02 in a place of service, and then where to put in the modifier.
Perfect. Alrighty. And let's give you back your slides up here. And I'll keep that up just in case you want to share it again. And then do you have info on network protocols for California-based plans in UMR, Sutter, ACN, and Wellfleet specifically?
So I know UMR told us they're not covering it at all. I'm not sure about the other insurance companies. As our clients are requesting verifications and as we're doing research for the worldwide tour of telemedicine, we are calling different insurance companies, but I'm sure that UMR told us they're not covering it.
If you have a 45-minute video of a patient, what codes and how many units do you bill?
So if I had a 45-minute visit with Jeffrey, I would bill for, right? Jeffrey, we go back to your slide of like, if we go back to how to bill for that. Yeah, from Cigna. Yep, here. So I would put in my start date and end date. I would put in a 02, and then I would put in via video 99423 because that covers 21 minutes or more, okay, with a modifier of 95. So you either fall into a category of 5 to 10 minutes, 11 to 20, or 21 or more. So 21 or more could be an hour, could be 2 hours, could be 5 minutes. That's the category you fall into. Anything greater than 21 falls into that one category.
Okay. And then do we indicate the different dates in the claim if we treat them on different days within the 7 days? For example, I spoke to Jane Doe on Tuesday, then on Thursday. Do I indicate April 7th and April 9th on the claim?
So we were told to put in the first date of service and just add all the minutes up, right? So if I spoke to Jeffrey today and then I spoke to Jeffrey again tomorrow, we put today's date of service and just add all the minutes up and bill for today is what we had told.
Okay. And then it looks like somebody is sharing something that they received. So my billing company sent an email to me on March 20th saying that effective March 6th, insurance companies are mandated to cover telemedicine regardless if it is listed as a service in your contract and cannot be applied to a new patient. Basically, she's saying that differs from what you're saying.
So it's not different; it's exactly the same, right? So it's not mandated, right? If you keep on reading, right, there's a disclaimer. So Jeffrey, let's read it again.
The question. Yeah. So my billing company sent an email that effective March 6th, insurance companies are mandated to cover telemedicine regardless if it is listed as a covered service in your contract. It cannot be applied to a new patient. So
there could be so many plans out there, and self-insured plans do not, absolutely not have to adopt telemedicine. The way that self-insured plans work is they hire insurance companies. So if I work for Amazon and Amazon buys insurance for all of their employees, they hire companies such as Cigna, United, maybe Aetna to pay out the claims. But in the end of the day, Amazon HR decides whether or not these claims are going to be paid or not, and not Aetna. So it's not the regular Aetna guidelines, it's the regular Cigna guidelines. And they're called self-insured because they can make their own rules. So it's not so accurate. But again, it would be best to call the different insurance companies and make sure your patients have coverage, because the one thing you don't want to do is tell the patient that they're covered and that they're not covered, and then they have these financial implications because now they owe you money and they're unable to pay it. So best is to call the insurance company.
Alrighty, and then somebody wants to know what to bill the VA. Maybe which codes?
Which codes? So it's the same codes that we're looking at. We were told to use the telemedicine codes to bill for. Yeah.
And then are herbal consultations covered under these codes?
Yes, absolutely. So, right, we go back to my slide of what we can do during our assessment. Part of it is herbal consultation.
Perfect. And then it seems like we would use a TLM or E&M code plus ADL code. Anything else?
What's an ADL code?
I don't actually know. Denise, maybe if you would like to send a clarification to that question, we can get that asked, and we'll go to the next one right now. So as of April 3rd, UHC will reimburse 99421 to 99423, and HCPCS G2061 to 2063 was the question mark.
So as I said, right, this changes daily. When we spoke to UHC last week, we were told that they were not covering it. However, right, great, you checked it. They told you they're covering. If that's what they published, that's great, and it's good to know. And we'll go and check back our UHC plans and find out if they're covering or not.
And then, are there any companies that you are aware of that are allowing new patient visits?
So we know that Cigna is allowing. We know that Aetna is allowing. We know that Oscar is allowing. So Oscar is covering it, and they are allowing. There are quite a few companies that are allowing new patient visits.
Alrighty, and the next question is, where and how do I write in a telemedicine modifier on a super bill?
So I'm not sure how you're doing your super bill, but usually when we submit the super bill, right, we put in the number, the quantity of what is it you're providing, and then the actual code, and next to it, I just put in the modifier. That's when we create super bills for our clients if they request any. So just fine, put a dash, the code and a dash with the actual modifier.
Okay. And the next question is, what's the overlap or not of Medi-Cal and ASH in California? Since ASH says no, but Medi-Cal is a yes for telemedicine, acupuncture, E&M.
So ASH administers, right, insurance plans for the bigger companies such as Blue Cross, such as in some states, for Cigna. They get directions from the bigger insurance companies. And so it really depends on the insurance companies that they administer the plans for. And they didn't say that they will not do it. They're saying that right now they're not allowing it because they're waiting for guidelines from these specific insurance companies. So, you know, it could be that tomorrow or in 2 days from now, ASH will allow it because they've gotten the actual guidelines. But as of right now, they haven't received the guidelines. And because they didn't receive the guidelines, they don't know if they should or shouldn't allow these services.
Alrighty, and then for the VA, is it okay to use phone codes even if they are not in my written authorization, or should I use 99213 E&M code? And then do I use 02 or 11 as the place of service? So
if it's not, I think that for most of us, it's not in the authorization codes because no one really could have seen this pandemic coming. We've been using the telemedicine codes. It's probably really good to call the VA. There must be somebody that you can call and speak to, and they'll tell you which codes to use. So I would start with the telemedicine codes. If those don't work, then just resubmit a corrected claim with the E&M codes.
Okay. And then somebody wants access to the slide. Is that
it's on the Cigna site also. Cigna published it, but here I'll get Cigna slide.
She said it was hard to see on the slide. Tell her where you found it on the Cigna site so we can maybe send her there.
If you give me a minute, I will actually log into the Cigna site and I will show you if I can.
Oh, perfect.
Give me 1 second.
Of course. And then while you're doing that, do you want me to ask one more question, or?
You can go for it, yes.
Okay. Next question is, how are ADL exercise and herbal prescriptions billed? The same question mark?
Absolutely the same, right? So it'll be exactly the same because while you're showing your patient exercises or herbal consultation or ear seeds, anything that you're doing with the patient on the phone is considered as an evaluation. You may have to make sure that you document it as such. And it's billed the same.
Okay.
Exactly the same.
And then next question, TriWest doesn't usually allow for consultations, but they sent out a document indicating providers could switch to telemedicine, but are they now covering consultations?
So we are seeing that they are covering consultations. But again, I would suggest you call them before you bill for it.
Next question. Legally, if a patient has insurance coverage for telemedicine, do we have to use it if we do a visit with them? And then Aetna only paid $44.55 for 9942.
So I guess it depends also on the state, right? So I'm going to go back. I'm going to show you Cigna in a minute. So it depends on the state, right? So prices are not the same across the country. They vary, right? How do they come? They come with the way that they determine the prices is based first if you're in network or out of network, right? Whether or not you have a contract with the insurance company or you don't have a contract with the insurance company. If you don't have a contract, they come up with what's reasonable and customary, because otherwise Jeffrey here, who's sitting on the other side, who's going to provide services, will charge $1,000 with the hope of getting paid $1,000, right? We can all charge different prices. However, the insurance company is a smart business organization, and they're going to come up with what's called reasonable and customary. They're going to look at where are you practicing, right? So what state are you practicing? What's the cost of living in the state practicing? What's most acupuncturists around you are charging for that specific service? And that's how they determine what's reasonable and customary for that particular code, right? So it could be that, right, in California, they paid $40. But again, right, in different states, we're seeing that they paid somewhere close to $50, and we're seeing that Cigna pays somewhere close to $70. So again, it depends on where you are and, you know, what county you're in, what state you're in, et cetera. There's a lot that goes into figuring out these prices. And then added to all of that, right, if they did apply the coinsurance, but the patient is not responsible for it, or they didn't waive it because you may be at work, right, it even makes the amount less.
Alrighty, and then can you confirm, did you say that the place of service for Cigna should be 11, not 02? Please.
Yes. And I'm just looking for Cigna and their announcement. Let me see, expand. Let me just expand for 1 second.
Of course.
So here it is. So hold on, Jeffrey, I don't know if you can make me a presenter.
So if you go up to Actions and then enable screen sharing.
Okay.
If it's open in a Chrome tab, then you click on Share the Chrome tab, and then you should be able to pick that one from the.
Are you able to see?
I can see it, yes.
Perfect. Okay.
So you can scroll down on this page and we'll see that, and you can also you could also zoom in if you'd like.
Okay, so I mean, I don't know if you see it as large enough, right? But what they did said use the face-to-face A&M codes. They are saying that you should use the GQ as a modifier. But again, all of this is on the Cigna site, and they write here that you can do this at least, right? And this is non-COVID-19. At least until May 31st, 2020. So all of these insurance companies do have guidelines, and they publish the guidelines until certain date. We're seeing that on Aetna, for example, it's until June 4th. So we suggest that you just check their website. And if you do a search on COVID-19, you'll find all their guidelines on their website. And I'm going to stop sharing.
Okay, if you click the little X that's right next to, or right at the bottom of that window, there it is.
Here we are.
Alrighty, and then let's move on. We have a couple more minutes. Actually, I think 1 more minute left of your time. Sure. Let's see. Will we more likely be audited by using the E&M codes without modifier 25?
I think that it's a good idea to use the E&M codes. You're probably most likely to get paid. You don't need a modifier of 25 because modifier of 25 signifies that you're doing an evaluation along or separately with acupuncture. We have to remember that acupuncture code 97810 always gets paid a little more than 97811 or 97814, right, when you compare it to, because they take it into assumption they are doing some sort of an evaluation towards the patient. right? But if you're doing an extensive evaluation, you're going to use the E&M codes, 99213, 99212. To separate, to say that this acupuncture and your evaluations were two separate procedures, you put a modifier of 25. But here, it's a standalone. You're not providing acupuncture services. Therefore, you don't modifier of 25.
Okay. Let's see. Next question. Sorry, my question wasn't answered. We are in network with a company. Do we have to bill insurance for telemedicine if the company covers telemedicine?
Do you have to bill them? No. You don't even have to provide those services if you don't want.
Okay. So we have like time for one more question from you. So I'm in California. Sounds like Cigna covers for new patients. However, does my California licensure and my liability insurance cover new patients?
Go ahead.
Nope, that's it.
Okay. I don't know what type of insurance you have, right? But we are hearing that the NCAOM does cover. Their insurance does cover. I don't see why it wouldn't be covered. Again, I will check with my malpractice insurance just to make sure that it's covered.
Okay, and then the very last question, if patients pay out of pocket, not billing insurance, is it okay for us to use telemedicine patients?
Yeah, go for it.
Alrighty. Well, looks like we got through pretty much all of the questions here. I want to thank you so much for your generous time. We really can't thank you enough, and we can't thank everyone else enough for taking the time to be with us today. We are going to be doing other states. We have Colorado coming up tomorrow, and then next week we will resume with Washington State, Florida, and a few others. So please check out the LASA OMS blog for the full schedule. Sarit, thank you again. I will look forward to seeing you tomorrow.
Yes.
All right.
Our tour.
Well, everyone have a fantastic day, and we will look forward to speaking with you soon.
Thank you, Jeffrey.
All right. Thank you. Have a great day.
Thank you. Bye.